So medical imaging can be a really valuable source of information for a lot of people who are in pain, especially through the neck and back. But what we're seeing now is that a lot of these imaging findings aren't exactly correlated with an exact cause of pain. So we'll be getting into that more specifically throughout the video, but this video in particular isn't going to be giving any specific medical advice, and as you probably guessed from the title of the video, these are just going to be 3 questions that I would ask your physician or radiologist, anyone who's giving you your medical imaging results. And medical imaging can include anything from MRIs, CT scans, etc., etc. They can be really valuable sources of information, but the thing about medical imaging is that sometimes they give abnormal readings, or what they would call abnormal readings, when in fact that a lot of the population has these readings and are asymptomatic, meaning they don't have any pain. So again, this isn't going to be any specific medical advice for people, but this is my way of giving, whether you're a client of mine or someone who's in pain, just a bit more power in figuring out what you should do to try and alleviate your symptoms. And we'll talk about surgery and conservative treatments and stuff like that. But as for now, let's just get right into it.
Okay, so the first question is, how common is this imaging finding? So when you ask someone this, I just want to put into context why. So back in 2014, I'm going to butcher this name, but it's Brinjikji et al. Put out a systematic literature review of imaging features of spinal degeneration in asymptomatic populations. So basically what that means is they took a look at 3,110 individuals between the ages of 20 and 80. What they measured were disc degeneration, disc signal loss, height loss of the disc bulges, disc protrusions, annular fissures, facet degeneration, and spondylolisthesis. So all of those are just a bunch of different, what they would call abnormal imagings within that population of 3,110. So what they found within of these subjects was that in subjects 60 years old and above, most of these findings were in 90% of them. And for individuals younger than 50 years old, they had about 70% of these findings. And between the ages of 30 to 39, so not very old at all, they found that more than 50% of them had these abnormal findings. So the next question I would ask is, are these findings found in largely asymptomatic populations? So the reason why this is the next question to ask right after the last one is because, as you may have guessed from the title of the last study, all 3,110 individuals with these abnormal findings are asymptomatic, meaning they have no pain, nothing. So the last question that I would ask is actually 3 questions that are rolled into one. So, is surgery recommended? If so, what are the normal outcomes of this surgery? And if not, who should I speak to for conservative treatments? So the reason why I would ask these questions is because sometimes surgery may not be the best option for certain abnormalities that we find through imaging. So to shine more of a light on this, I'm going to refer to a systematic review put out by Lowe et al. In 2017. It was a systematic review of the literature surrounding sham surgeries in orthopedics. So what they did was they took 6 randomized controlled trials involving 277 subjects, where one group received the actual surgery for whatever condition they had, and the other group received a sham surgery, which was unknown to them at the time. Then they measured the outcomes between the 2 groups. So before I get into the outcomes, the surgeries that they looked at were vertebroplasty, intradiscal electrothermal therapy, arthroscopic debridement of osteoarthritis of the knee, and open debridement of the common extensor tendons for lateral epicondylitis, also known as tennis elbow. And what sham surgeries are, essentially, is that they mimic the actual surgery itself with regards to the pre- and post-operative education, the sounds that you would normally hear during the surgery, the duration of the actual surgery. They even go as far as to imitate the smells of the surgery room and the operative room, as well as the rehab process of the actual surgery. So what they noted between these different surgeries and the sham surgeries was that The outcomes were measured from 3 months all the way up to 2 years post-surgery, and no difference was actually noted in the outcomes between the actual and sham surgeries. Every surgery had the same outcome, with the exception of intradiscal electrothermal therapy, which actually did show to reduce pain more so than the sham equivalent. So before I finish up this video, there's one more thing that I think is worth talking about, and that's the actual effects of getting imaging done early on when symptoms appear. We can get what's called iatrogenic consequences, meaning that iatrogenic is just a term that's used to mean illness that is caused by, or at least increased by, the actual medical procedure itself. So here's what I mean. There's been quite a bit of evidence that shows when we start getting symptoms like back pain or maybe knee pain, wherever like the pain is, when we get early MRIs or CT scans over the area, it actually can lead to an increase in those same symptoms. And there are a few things that we can attribute to this, such as overprescribing certain things, over-testing certain things, catastrophizing the findings, increases in fear, and an increase in surgery without improvements in outcomes. So all you need to do is just make sure that you're informed about the imaging findings that you get. Make sure to ask these questions or any others that you can think of. But thanks for listening, and I hope it was informative.